honestly think that the model of the future is being driven by moms that are compassionate towards their children. It's like they already carry the purse strings of America around healthcare, but like when they see their child develop a developmental disorder after some sort of a vaccine or a procedure, or they develop some sort of a challenge, like they're compassionate, they ask questions, right? They may not even be anti-vax. May not even be like against the medical system. They're just asking questions because their child got harmed. And it's not like, my mom and dad moved away from medicine because I know that they, use aspirin for pain or whatever still. So, but they asked intelligent questions around like, hey, is there a better way that could work for my son who's now been diagnosed with ADHD and dyslexia and is in special needs? And as soon as they picked a different path, all of a sudden there's this massive upgrade in my brain function to the point where I was like, I knew I was smart. And when I was on all these medications and struggling in school, there was a side of me that was like, am I stupid? Because I feel stupid, but I know that I'm intelligent. And I've had glimpses of intelligence, but I have a hard time communicating with other kids and yada, yada. And then all of a sudden it was like a light switch was turned on in a dark room. And it started with her being like, look, I want to be open to a conversation that is, is an important conversation to have, that, that could challenge my upbringing and everything that I know about what I thought healthcare to be. And all of a sudden it worked out, right? So it didn't just work out. Like I ended up getting an international academic scholarship. I was on the national dean's list. My dean of the university let me double up on classes. So I was a doctor at 24 years old. So it was like, but I see how many more little Isaacs are there out there right now that are being suppressed and depressed by the current quote unquote healthcare system that's a disease care system that's propagating all these lies, that is holding these children back from their greatness. So that's what I really want to help doctors like go out there and change the world, build brands, build businesses that serve and transform people's lives.
That's incredible. It's so interesting. I mean, you mentioned the ADHD medications with Adderall. You mentioned Accutane, which I personally took in high school, and know the struggles of what it's like to one, have acne, two, take the pills that are also just loaded with side effects that they talk about. But, looking back, I'm like, if you just looked at my diet, you would know exactly why I had acne. There was clear, like at home, I was eating the right things, but at school lunch, I was eating potato chips and nachos and loading up on sugary chocolate milk. So many things that were contributing to the acne that weren't being addressed before the conversation of, well, let's just give him Accutane. So that hits home for me. But I'm curious. So you said the moms of America are where this problem starts to change. And I'm curious, how would you kind of convey that message to them? There's basically two routes, right? Is that kind of how you would describe it? Like more of a pharmaceutical approach, treat the problems versus treat the underlying issues.
Like philosophically, they call it ADIO, right? Above, down, inside, and out. It's an approach of like, you believe that there's an amazing creator that created your body, that put an intelligence in your body, or what they call an innate healing and regulating power, that when you allow for there to be no interferences with that innate healing and regulating power, and you allow for that, because here's the thing, if you cut your hand, you don't need a supplement or a medication for that cut to heal. Like there's already an intelligence in your body that creates that cut to heal, naturally. That's the innate intelligence of your body. But the modern science avoids even working with the intelligence. It's all about essentially a hammer and nail approach, where if you have a symptom, we're going to cover up the symptom like a duct tape over an oil light on a car. And if you use the duct tape, yes, you cannot see the oil light signal anymore on the car, right? It's completely out. But did you actually address the underlying cause, right? The Accutane, did it address you and I eating Skittles at lunch? No,
Nope.
it didn't. And so that's the challenge. So we want to, the approach is, okay, how can we work with the innate healing and regulating potential of the body? How can we work inside out of the body, allowing for the body to release its intelligence at the highest level? And then when you work with the body, then you create an N of one approach, which is the future of healthcare. The medical system is what they call a population-based system. So if you took 100,000 people and gave them, let's say, Vioxx, right, or a different type of heart disease medication. Let's say 1,000 of the 100,000 people die, right, or have a major side effect. Well, that's only 1%, right, of the 100,000 people. So you could say, oh, like only 100,000 people or 1% of people will have severe effects with this particular medication. And then, 99% of people, are fine. And, there could be 30% that have other lesser side effects or whatever. But like you are taking a pill based off of population-based data that may not be specific to what your child needs or what you need. So the approach is, population-based or personalization-based. You want to take a personalized approach always, right? That's the N of one approach. That's the future of healthcare. N of one is like a study that is done on one person. So it's kind of like a healthcare approach that's done for that one individual. And that's what my parents didn't have a whole lot of money growing up. My dad was a janitor. My mom didn't really work much. And the bottom line is they still brought me to these doctors, that these doctors still helped me. And it was like an N of one approach, and it completely transformed my life. And I'm so grateful for them. So the second thing is, do you want to work with the innate intelligence of the body, or do you want to work against it by taking something from the outside in, or work, from the inside out and align yourself with the already intelligent, incredible intelligence of the body? I'm a part of this $50,000 a year mastermind where we bring together, it's a clinical mastermind, we bring together all these research scientists and doctors to talk about the future of healthcare and specific to regenerative medicine and longevity. And what was so interesting is we talked to the smartest guy who has discovered all these things about the mitochondria and how to reverse age. And he's like, this is all that we know about the mitochondria. And it was a lot. It was like, whoa, there's so many things that we know about the mitochondria. He's like, this is what we don't know about the mitochondria. And it was like, it was so overwhelming how much we don't know that we don't know about the mitochondria, that I was like, oh my gosh. And it just made me realize, we think we're smart, but our bodies are way smarter than what even scientists are saying is the thing to do, right? So you just have to be aware that there's so much more that we still don't know about what we don't know about the human body, about biochemical pathways, that we have to really be aware of. And the last thing I'll say is that, when you do one thing in the body, it's not like a car, right? A mechanistic approach is like, look, my engine is starting to sputter. I'm going to replace the engine, right? Or my tire is flat. I'm going to replace the tire. Well, in the human body, if you affect the heart, you affect the brain. If you affect the gut, you affect the lungs. There's so many interconnectivities within the body. That is the vitalistic, holistic approach to healthcare that all the mothers of the world should be thinking about. So, customized, personalized approach, inside out versus outside in approach, as well as a vitalistic, holistic approach versus a reductionistic, mechanistic approach to health.